Welcome to Dr. Krystal's podcast, Inspiring Sacred Stories. I am your host, Dr. Krystal, a doctor of East Asian medicine and a holistic transformational coach. Here we will shine light on wisdom keepers, paradigm shifters who inspire us to live thriving, joyful lives. Let's be inspired. Although I am a doctor of East Asian medicine, this podcast is for educational and inspirational purposes only. It does not replace professional medical advice. Please consult a qualified healthcare provider for guidance on your personal health needs. Welcome. Thank you for joining the Dr. Krystal podcast, Inspiring Sacred Stories. I am your host, Dr. Krystal, and today's guest is Chris Lindley, Chief Population Health Officer for Vail Health. A mutual friend connected us over a year ago, and I remember going to Vail Health and reading your bio, and I was really taken back and impressed. I read your bio and I thought, wow, this is a man who has big vision. He's a trailblazer on purpose and makes things happen. And then when I met you in person at your gym, you emanated exactly that. You emanate kindness, purpose, and mission driven. So I'm so grateful to have you. It's really an honor. So
Well, thank you. I think we'll just stop right there and call this a wrap.
Well, it's the truth. I invite everyone to go read your bio because you've
Gee.
done some great things and you've made some good things happen in this community and in the broader community for our country. So we always start off with asking people, what does sacred mean to you?
Wow, great question. So sacred to me is, I think about where I use the term, and most recent time I used this term was a mountain biking experience I had here in the Eagle River Valley, a new trail that was up above Beaver Creek. It's just a couple weeks ago. I was going through beautiful fall aspens. The leaves were falling. The trail was golden from all the leaves on the trail. It was amazing. New trail that was created for all of us to enjoy. And to me, that experience and that ride was a very sacred moment of where I'm hopeful that as long as I can, I live, that I can have that memory and drum up that feeling of kind of that freedom on the bike in the space, going down the trail in the aspens, the light coming through. So to me, that sacred experience is something that you hold close, that really moves you in some way,
Mhm.
inspires you, and it's something that you seek again in the future. So I gave a good example of it, being outdoors and involved in physical activity at the same time. But it could be indoors, a space experience or something. It's just something you hold closely that I think moves you personally, in a spiritual way.
Yeah, I love that. We were just at the Arches.
Yeah.
Yeah, and I had the same experience of like, I'm like, all is well in this space, in this moment, just seeing
Yes.
that beauty. So, yeah, thank you for sharing that. And as you know, the podcast is about sharing sacred stories. So I would love to hear what story I know you probably have many, but what's that one story that you feel like sharing today?
Oh, this is tough. Well, I think one story I'd like to share is one of community community collaboration and commitment to a vision and an objective that I don't think any one individual truly believed could be accomplished. But what we've done here in the Eagle River Valley, starting back in 2017, the summer of 2017, was realizing that we had a significant problem related to our behavioral health care system or lack of system. We did not have a system here in this valley. There was no organizational lead or structure, and no real collaboration. There was a lot of independent practitioners, a few nonprofits doing work in the space, but nothing was organized and pushing towards a vision of what could be possible. Over the course of a few years, from late 2017 to 2020, we found a way to collectively raise some money through a countywide tax. We actually taxed marijuana. It was going to be taxed anyways, and so we were able to apply those taxes to support behavioral health, mental health in this community, and came up with some overarching objectives that we'd like to accomplish over a 10-year period, really starting in 2020. It's now 2025, so it's been 5 years. We had set a 10-year objective, and we've accomplished all those activities that were on this big, audacious, bold
Mm.
10-year vision already. They've all been accomplished. In fact, almost all of them have been kind of doubled or tripled in size and impact, and it's really unbelievable. And it's this, to me, just ex hopefully for others involved in the community, it's this sacred uh, ex experience we've all had where we've gone from being kind of the worst of the worst in the country for behavioral health services to now, I really believe this valley is the best of the best in the country for behavioral health services. We've got amazing nonprofit organizations doing amazing work every day, whether it's in the community, in workplaces, in schools. Um, and not just your traditional ones. We have nonprofits, of course, working on suicide ideation, but we have nonprofits working on uh, gender identity challenges and stigma in that space, working on building new trails out in the community,
Mm.
nonprofits getting kids involved in after school programs and mentorship and support, domestic violence support group. It just goes on and on. They're doing great. But we've also built a service line of behavioral health care, clinical care that accepts all major payers as well as those that can't pay. We have an amazing scholarship fund, and we're now seeing over 4,000 patients a month on the
Wow.
outpatient side. And I don't want to use the word patient because that has uh, a feeling that someone's sick, and
Right.
that's not what we're about anymore. It's, when you go to the dentist, most of the time people go to the dentist, it's not to get a cavity, it's to get a cleaning, right? And we really want behavioral health to move in that direction where we all have a therapist or a provider that we work with that provides that maintenance level health, education, wellness support. But yeah, 4,000 people are actively using our services per month right now. We have psychiatrists and psychologists and family therapists and sports therapists. But we also have just opened up an inpatient psychiatric hospital, the
Right.
only one between Denver and Salt Lake City. It's incredible. We've had 5 months under our belt, 100 new FTEs, so employees for the system work in the facility. They're providing great care. I spend a lot of time over there with them, and we're learning a lot. But what I can say is we really have a full continuum here. And to me, that whole experience over these 7 years has been this, sacred experience. And it's been with so many people, so many nonprofits, organization, patients, individuals. And it's just, you know, I certainly will never forget it. So unbelievably proud of where we all are. But to me, like we're impacting the community so much. And last thing I just say, Krystal, sorry I talk so much, but
Oh, this
our
is
suicide rate in this county is 66% of what it normally is. We've moved the needle dramatically in the right direction on reducing completed suicides, which is fantastic because a lot of the country, unfortunately, is still moving in the wrong direction where there's more suicides
right.
taking place. So we are seeing some real impacts as well.
Well, congratulations, first of all.
Thanks.
Yeah, I'm so happy for you and for the collective, everyone who's played their part. And yeah, I'm new to the Valley, but I have heard that that mental health was a concern in the community, and then I hear all these amazing things that Vail Health, behavioral health, that you and a group of people have spearheaded, and in that hospital, a couple of friends work there, and so
Yeah.
I'm celebrating you all, and so. I'm curious, what has driven you to be so motivated to do these things for the community? Because this isn't the first thing that you've spearheaded and opened up. Like you were a part of the Hope Center, and you've done lots of things. So like where's that drive come from inside of you?
Well, I don't know if it really comes inside of me per se. All these ideas and everything we built have been other ideas. Like it's listening and hearing uh, where things need to go. But it's really then having the next step of taking definitive action. Many times people have brilliant ideas and insights, but what happens is they fail to take the first step for a host of reasons, right? Maybe they don't believe that it will actually be successful and they have the fear of failure. Um, Maybe they feel like they're too busy or it's someone else's role. And for me, I've been failing my whole life, and so I don't have a lot of fear of failure, to be honest.
Hmm.
And so when we hear these ideas and these opportunities to better our community, better our organization, or the best is save a life or improve a life, I'm always all in, and I'd rather fail two or three times before the next individual even starts and be on our way, right? I think growing up in behavioral health and public health, my training is in public health. I am an epidemiologist. I worked for the federal government in the early years and then the state government for quite a while, almost 9 years. And what was unbelievably frustrating was we talked and studied every challenge, every issue again and again and again and again and again. So
Right.
every time we got some more money, it's like, well, let's study it. Let's study to see what we want to do.
Wow.
Well, we know what we need to do. And so what we've done here in behavioral health is we've not studied the problem here in this valley. We've taken definitive action on those things that we knew were shortcomings. And rather than spending the money, the time, and the effort on writing a study, writing a report, we spent that time, money, and effort on moving forward
Taking
and
action.
making adjustments as we moved forward, as we learned more. And so it's that forward progress. You just got to get the momentum going, and it's a lot easier to accomplish a lot more once that momentum's going. But that first step is so hard for so many communities and so many people.
Right. So why do you think there was in the valley there has been such a mental health crisis?
Oh, that's the million dollar question. It's a lot of factors, right? This is a hard place to live as a working class individual. We are in, I think, is the most beautiful valley with some of the most amazing experiences you can partake here in this valley. Anywhere in the world, people travel all over the world to come here to
Right.
enjoy our winter sports and our summer sports, as well as even fall, which we are just going through right now, which is so beautiful. But when you live here, it is very expensive to live here. It's very hard. Most people I know and my family members have two jobs. Some have three jobs, right? Everybody
Right.
jokes about what their side hustle is, right? But that's just a way of living up here to afford their rent or their mortgage because housing is so unbelievably expensive. And so one thing that always saddens me is folks will move here to get a new start on life or to be more connected to the outdoors and the mountains. And they move here, but they never really get to experience here
Mm.
because they're too busy surviving, right? They
Hustling.
don't,
Yeah.
they don't have the money or the resources to do the experiences that everybody that's traveling here gets to do. So you're
Mm.
kind of watching this group of people show up in your backyard and enjoy all your hard work and your lawn care and your beautiful backyard and your barbecue, and you never get to enjoy it or eat the food, right? And so I
Yeah.
think that weighs heavily. The other thing is living in the mountains anywhere can be a bit isolating as well. And it's a bit intimidating up here. I mean, everybody is, um, I joke, but this is really true. I mean, the level of health and education in this valley is bar none. I mean, just
Yeah.
the most successful, smart people you'll ever meet, and also the healthiest people. So if you're new to
Yeah.
this valley and you want to take up mountain biking, well, you're going to be the worst mountain biker on the mountain for a long time.
I
Like
know.
everybody's going to beat you. Trail running, everybody's going to beat you. You name it. Everybody is just so incredible at their gifts. And so when you're coming in new to this, it's very intimidating and it's hard to make those friends and find those connections because you just assume like I can't hang with that group, right? They're just
Yeah.
um, ahead of me. And the truth is, and we all know this, that group would welcome anybody to them and they would
Oh,
wait and slow down. But that's our own insecurity of coming in and being vulnerable and saying, I'm really trying to make some connections, make some friends. I'd love to join you on whatever the experience is.
right. Well, I'm new to town, and I found when I went to your gym through a friend invited me.
Yeah.
It's an amazing athlete, like
Yeah.
elite athletes, totally. And she invited me to come to the strength class. And I was so in awe of how fit everybody was,
Yeah.
but yet they slowed down for me and they helped me out and they showed me where the weights were and they would take the weights off so that I could still lift the weights. And I
Yeah.
walked out like, oh, I feel like a sense of belonging here.
Yeah.
And I
And
drive
they,
I
and I
drive from
guarantee,
Edwards all
yeah.
the
And
way
I,
down at 5 in the morning because I feel like I belong.
Yeah, and you do, and they love that, right? They
Yeah,
enjoyed meeting you and having a new person in there with them and making a friend. And that's, I mean, I think that's the biggest challenge we all have is our own insecurities, right? If you're just vulnerable and open and willing to take the risk like you did,
yeah,
you'll find that most of these groups are just unbelievably welcoming and would love
yeah.
you to be part of it.
Yes, and you even had a walking group and there's also the group, forgive me, I can't remember the name, but it's for sober living and connection, reconnect, is that what it's called?
Yeah, Reconnected is a fantastic nonprofit here in the
Yeah.
Valley. Rob Sheehan runs that group and has a lot of amazing collaborators on what they do. And they're getting people outdoors. They're doing big events. They're organizing fun evening activities, weekend activities, and it's all around having fun without alcohol. It's
Yeah.
fantastic. And it's, just touching on alcohol briefly, it is the Achilles heel of this valley. If this valley has an Achilles heel outside of the cost of living, it is the use of alcohol.
Yeah.
It's sad how much alcohol is influences most experiences. It's hard to find uh, ac- activities that don't have alcohol involved, and we're starting to see more and more um, move in that direction. Rob's group's doing it. Vail Health has been having some of our events without alcohol, and it's remarkable. More
Yeah.
people actually show up. You have a,
Yeah.
a really cool mocktail bar.
Yeah.
Everybody loves it. They're like, this is great. I'm going to wake up feeling great tomorrow. I'm not going to
Sleep
have any
better.
guilt. And it's like, why don't we do this all the time? Like, we all know what
Yeah.
we should be doing, but we let social pressure many times move us in the wrong direction.
Yeah, absolutely. Well, thank you so much, Chris. We also like to end with is there one sacred practice that you do either daily or as a
Yeah.
ritual, ceremonial, like
Yeah.
seasonally that you'd like to share with with whoever gets to hear this to inspire them?
Yeah. And so um, I'll talk about the things that I do frequently, but then I'll cover the sacred practice. So daily breath work, I do as frequently as I can. I don't do it every day. I would like to, but um, sometimes I lack the discipline to fit it in. But every time I do daily breath work, I immediately feel the benefits of that and appreciate it.
Mhm.
But for me, one of the sacred things that I always am reminded of how just impactful it is for me and how much I enjoy it is actually going to the gym and lifting weights with friends.
Yes.
And I love it. And it doesn't matter if it's a competitive day or just a fun day. Like it doesn't have to be a super hard workout, doesn't have to be an easy workout, but just the fact of spending time together,
Mhm.
kind of giving each other a hard time, some bantering, investing in our body in some way, in our health. I I just always feel so great after that, and it moves my day from that point forward. And so that's like my sacred hour is getting to go do that, but with friends. Like
Yeah.
I
There's
don't
something
have the
about,
same experience alone.
yeah, I agree. There's something about meeting and that
Yeah,
camaraderie and that
yeah,
oxytocin releases and
it's all true.
endorphins and all
Yeah,
that. Yeah.
it's fantastic. So, yeah, meeting new people and talking about health and wellness never gets old to me, and it always fires me up and inspires me.
I love that. Well, thank you so much.
Thanks for having me on here. Yeah, this is
Yes.
great.
Thank you all for joining the Dr. Krystal podcast, Inspiring Sacred Stories. Until next time, find the inspiration in the sacred in everyday life. Thank you for joining me on Dr. Krystal's podcast, Inspiring Sacred Stories. If today's episode lifted you up, I'd love if you shared it with a friend, subscribe, leave a comment. It helps more people discover these stories of light and transformation. And if you'd like to work with me more closely, head over to www.drkrystalkinnunen.com. And as a thank you for listening to the show, you'll receive $20 off your first session. Details are also in the show notes. Remember, in this time of rapid change and transformation, you are not alone. You are part of a greater shift, and your inspired life matters. Until next time, let's be inspired.